allocate some time from the at-large member from the great state of North Dakota, Congresswoman Fedorchak.
Thank you, my friend. Really appreciate your leadership on this issue and organizing this special order, inviting all of us freshmen and a few other non-freshmen here to talk about an issue that is so important to our country and to all of our constituents. Mr. Speaker, our healthcare system is broken, and my constituents in North Dakota know it. The law that was supposed to make things better, the Affordable Care Act, has definitely not lived up to its name. If you like your plan, you can keep it, they promised. A typical family will save $2,500 a year, they assured. The ACA will help bring down healthcare costs and even reduce the deficit, they claimed. Well, none of that is true. Here we are, fixing the Obamacare mess Democrats created 15 years ago. Families today are paying higher premiums, facing fewer choices, and watching Washington throw money at a problem that needs to be fixed immediately. And yet somehow, my colleagues on the other side of the aisle continue to paint this as a problem that Republicans created. The reality is, Democrats passed Obamacare without a single Republican vote, not one. And they also set the enhanced premium tax credits to expire this month. Ask them why. They had the votes. They could have extended this. They could have made it permanent, but they didn't. They set the expiration date for this month. This was completely their doing. The COVID-era enhanced premium tax credits expanded eligibility far beyond the ACA's original design, including households earning well into six figures. In North Dakota, that means a family of four earning over $125,000 a year. Making those temporary subsidies permanent would cost taxpayers $350 billion over 10 years. And for all that money, it still won't fix the problem. Since the enhanced subsidies were enacted, premiums have increased 31%. 31%. And these subsidies don't show up in people's wallets. They go straight to the insurance companies with no incentive to lower prices or improve care. Even worse, massive fraud plagues the marketplace. A recent Joint Economic Committee study found roughly 35% of marketplace enrollees are now considered phantom enrollees. These are people who exist on paper but generate zero medical claims. The chart on my right shows a massive growth of these types of claims, all the way up to almost 11 million of those types in existence today. Regardless of whether they have a single claim in a year, insurance companies still get paid anyway. And while working families pay more and more and more for their premiums. Democrats call that affordable. North Dakotans sure don't. That's why Republicans offered a different path last night, one that focuses on patience, affordability, and real competition, not endless subsidies. The Lower Healthcare Premiums for All Americans Act takes practical steps to lower costs and expand options. It creates cost-sharing reductions that will actually stabilize the market. These will reduce marketplace premiums by 11% after the first year of implementation. That's nearly twice as much as the impact of extending the Democrats' credits. Our plan also cracks down on pharmacy benefit managers, the middlemen who drive up drug prices. Our plan requires transparency so employers and workers can finally see where their prescription dollars are going. It also expands association health plans, allowing small businesses and self-employed workers to band together and increase competition. This could lower premiums by as much as 30%. Our plan also protects employer-sponsored insurance and strengthens flexible tax-advantaged options like choice arrangements. These reforms give workers control over their coverage dollars and lets employers offer benefits for the first time. Most important, This is just the beginning. We have many more policy reforms coming. Republicans' vision for healthcare is putting patients, not insurance companies, in control, with greater access, more choices, lower costs, and good quality care. These are common sense reforms. It's past time we move beyond temporary patches and tackle the problem head on and fix what's broken. Thank you, Mr. Speaker, and I yield back.